about Medicare Advantage and all of the reasons why it might not be for you. I've got Thomas here with Chapter. He's the organization. He represents the organization that helps all y'all with navigating the nightmare that is Medicare. Once you have Part A and Part B from Social Security Administration, you go ahead and enroll in that. Then you have to find out some type of plan to fill in all those gaps of original Medicare. I wish there weren't gaps there, but there are many, many gaps in Part A and Part B. And if you just have Part A and Part B alone, then you're going to have a lot of financial risks. So it's either good to get a Medicare Supplement Plan or a Medicare Advantage plan. Several weeks ago, I did a video on the 6 reasons not to get a Medicare Supplement Plan. And this is the second part of that. This is 7 reasons. I always throw a bonus in there. 7 reasons not to get a Medicare Advantage plan, because there's reasons to not get one versus the other, and it's 100% based on your particular situation. So we want to make sure everybody out there gets the plan that's best for them. And so let's go ahead and go down through the list. This is also a live Q&A. So if you have any questions on all things Medicare or Social Security retirement, survivor benefits, spouse benefits, my name is Ed Weir. I ran the 3rd busiest Social Security office in the country, and I can help you make sure you're getting everything you are entitled to. So make sure you type your questions there in the chat. If you're watching this or recording, make sure you subscribe, and that way you can find us again in the future when you do have questions or get one of those strange letters from Social Security, and I will be able to help you translate it into English. All right, Thomas, let's go ahead and go through the list here. So we've got 7 reasons why Medicare Advantage plan might not be for you. I guess the biggest thing right now is the fact that all these plans are being canceled. So right now, this is October. The annual enrollment period begins October 15th, ends December 7th. And so this is for plans for 2025. And what we're seeing is the numbers I've seen is about 1.5, 1.8, close to 2 million people are having their Medicare Advantage plans canceled. Is that the numbers you're receiving?
Yeah, that's the numbers we see as well.
Yeah. And people ask me, I just got a comment yesterday, which plans are being canceled? Well, it's, they asked me that in a YouTube comment, and that would take 30 pages to respond to. So number one, why are these plans being canceled?
There's a few different reasons throughout the country. And again, the plans that are being canceled are dependent on your area. So you may not feel it as much in like South Carolina as you would in like Washington or New York or places like that. But they're being canceled because of the changes that are happening with the prescription drug coverage. Because of the exposure these insurance companies have now on the Part D side, they're not able to create as benefit rich plans on the medical side. And they have 2 options. Either they uh, greatly reduce the benefits you see in the plan, or they get rid of it entirely. And another step that they may do as well is greatly reduce the number of plans that they offer in an area. So there's a couple different ways that insurance companies are reacting to all the changes that are happening within Medicare. And this is one of them.
Yeah, I see. In particular parts of the country, I know in like in Missouri, there are companies that are just leaving completely. They said, okay, we can't make money in this particular state, so we're just going to leave the state completely. And so those people, you have to find another plan by December 7th. And it's good to go ahead and get that out of the way now before you forget, because if you don't, then in January, you're going to be fully exposed. You're going to go to the doctor and they're going to hand you a bill for $3,000 or $4,000 or whatever the case may be. And you're going to say, I have this Medicare plan. And says, no, that was canceled. So you have to make sure you get another plan. And then, so there's companies leaving particular areas, and there's companies that a lot of people don't recognize, that there are companies that have, in most areas, the same company has 2, 3, 4, 5, 6 different versions of their plans, and they come out with a new plan every year, sometimes, and their previous plan that you may have had for the past 2 or 3 years, that gets what we call downgraded. So we see a lot of plans out there. The company is still going to stay around, but in order, because hate to break the news to people out there, but these are for-profit institutions, correct? All these healthcare companies,
Of course, of course.
and they make a couple of bucks, don't they?
They make more than just a couple.
All right. So what they're doing is I call it kind of their soft canceling. So if your particular company decided to go ahead, they're going to stay in your area, but they're going to, they want to make more money. What they're doing is they're downgrading your plan. So people don't realize, well, I've got this company, I've always liked them, I've got my doctor, it's zero premium, I'm good, I don't have to do anything, I'm good, I don't need to mess around with this stuff, I don't need to spend an hour of my life calling Thomas and his team to see if I need to review the plan because I'm good. Well, you might not be good, you might still have the same company, you might still have the same doctor, it might still be zero premium, but everything else just might have changed. What are you seeing out there for the biggest changes under the hood?
Sure. So when we take a peek behind the curtain, a couple things that we're seeing, of course, one is the prescription drug plan changes that you've seen all over the news, as well as in previous videos that you and I have talked about the Part D changes. In addition to that, what we're seeing is some of those extra benefits that you might be accustomed to seeing, like your dental coverage, your over the counter, your vision add ons that are within these plans may be reduced compared to years previous because they have to make it up elsewhere from that Part D change. Another area that most people overlook is maybe like lab services, MRIs, CAT scans, and other diagnostic treatments that aren't as widely used, or maybe they're not as quick to go check what the line items are there. Those are some areas that they're kind of sneaking in some higher costs than they've seen in previous years. So you might notice your primary care doctor might still be zero to go visit her or him, but when you go to actually get some diagnostic work done, you're going to get some surprise bills in the mail if you don't take a review of that plan for this year.
Perfect, perfect. And as I mentioned, you can reach out to the person that signed you up. If you've got, obviously, a lot of people out there have relatives that are helping with Medicare insurance, or a high school friend or something like that, then obviously go to them. You've got to review your plan. But if you don't have anybody to help you out, you can reach out to Thomas and his team there, and they can definitely help you out. Another thing, another reason to to not get a Medicare Advantage is the restrictive networks of doctors, hospitals, clinics, all the rest of it. And there's also doctors. So a doctor, when they sign up for a plan, because when people sign up for a Medicare Advantage, it's good for 1 year. So only 1 year. So at December 31st, midnight, like Cinderella, it disappears. And maybe the same plan renews next year, but it's usually with changes, and you don't know those changes until you review. But doctors can drop those plans mid-year or anytime they want. Is that true?
That is true. So the way it's structured is usually you have a group of doctors together that are creating like the network for themselves, if you will, and then you'll have a separate setup for the hospital itself. And both have to negotiate with these plans every single year to decide whether they're going to stay in these networks. One of the cruel things that we see sometimes is these negotiations are ongoing throughout the annual enrollment period. So what may uh, look to be a network right now may not be a network by December 7th. So it's very key to ensure that you continue to open that mail and continue to see what your doctors are telling you about what plans they are or not accepting for 2025. This is creating a lot of uncertainty in the space, and a lot of people have voiced that they just have lost complete peace of mind when it comes to their Medicare Advantage plans. So yes, restrictive networks because I mean this controlled by the insurance company. They only want to let certain networks and hospitals work with their plan because they can negotiate the specific rates that they want. But in the event that they decide later on, well, hey, this isn't a good deal for me from a doctor's perspective. They're like they're not paying us. Maybe they're slow to pay their claims. Maybe they're just the negotiated rates much lower than they had anticipated when they signed on the dotted lines. They can leave mid-year, and what that causes is unless you have your own special enrollment period, you're stuck in that plan until the next annual enrollment period, which means you can't see the doctor that you've been seeing for the time that you've been on that plan. So it's completely out of your control at that point.
Yeah, that's the tough thing with Medicare Advantage. I've seen it many times. Someone is like they talk to their son-in-law or something, and that person is helps them with Medicare Advantage, and the son-in-law checks, and oh yeah, your doctor is definitely a network. You're good. Let's go ahead and sign you up with this one. And then it turns out a month later, the doctor decides to drop it and the doctor is no longer in network. Yeah. So it's kind of tough out there. And you see every single day, it seems like another hospital or system says, yeah, we're not going to renew the contract with this particular company. And you're just kind of out of luck. And this is for only Medicare Advantage. So this whole thing is crazy, confusing. I wish the American healthcare system wasn't as confused. Well, the healthcare system is great. It's one of the best in the country. The kind of the insurance part of it, that's what's that seems to be the nightmare. Um, but we see, the Medicare Advantage; those have networks. Original Medicare, that's not what doctors are dropping predominantly. I mean, most doctors don't drop accepting Medicare. Obviously, there's a few percent out there, but hospitals don't normally drop original Medicare. So what we're talking here today is about Medicare Advantage. So if the alternative to Medicare Advantage, as I talked about a few weeks ago, are Medicare supplements. Those are the ones you see: Medicare Supplement Plan N, Plan G, Plan F. But those are, if you're 65 years old, you're new to Medicare Part B, you can get those. There's other special enrollment periods. You can go ahead and get a Medicare supplement plan. And the beautiful thing this year about all these people being canceled, close to 2 million people being canceled, those people now have special rights to sign up for a Medicare supplement. So when somebody calls you and they say, "Oh my gosh, what am I going to do? I've been canceled." What's the first thing y'all do?
Sure. So the first thing that we do is get an idea of how they've used their program up to that point, knowing full well that the advisor is aware of their guaranteed issue period for that Medicare supplement. And for those that may be new to your channel, a guaranteed issue period is just something where you can go into a Medicare supplement plan without having to undergo medical underwriting, which is very difficult for people to have to go through because how restrictive they are with their procedures there. So what we're going to be asking is, well, how many doctors do you see? How many prescriptions do you take? What are your priorities? And how much freedom do you want to have in your medical choices? Because the more freedom you want, the more peace of mind you want, the more control that you want, a Medicare supplement route is going to offer you that where a Medicare Advantage can't.
Okay, perfect. Yeah, and the deciding factor, everybody I've talked to always wants a Medicare supplement plan. But the issue is, as I talked about when I did the Medicare supplement video, is there is a monthly premium for that. With freedom, unfortunately, comes a cost. So we'll
Of
talk
course.
about that here in a little bit. A number four is prior authorizations. Another reason a lot of people stay away from Medicare Advantage plans is they have prior authorization. So that means if the doctor says you need some type of treatment, that's not the final word. The final word is they have to submit it to their insurance company. I've gotten people that said, "Well, I've never had a prior authorization. I never had an issue with that." Other people said, "Well, I had a terrible issue with that. I was denied or delayed or whatever the case may be." And there's a lot of companies out there that, for specific things, they're doing prior authorizations. Original Medicare takes things differently. With original Medicare and therefore a Medicare supplement, there are no prior authorizations. If Medicare covers it, obviously, the cosmetic thing, I couldn't go in there and get a hair transplant, unfortunately. And we're going to work on that one, right, Thomas? We're going to make sure
Of
that's
course.
covered by original Medicare. But yeah, anything I think of short of cosmetic type stuff, if it's medically necessary, Medicare just goes ahead and do it. There is no prior authorization. How they do it is they go after people after the fact. So if there's doctors out there doing shady things and that were not medically necessary, that's when they go after the doctors and close them down and sue them and hopefully put them in jail and all the rest of the stuff. But Medicare Advantage companies, they kind of you know do that on the front end, and that's where the prior authorizations come in. And so there's benefits for both, but a lot of people don't like an insurance accountant getting in between them and their doctors. So prior authorizations, the networks are probably two of the biggest reasons people stay away from Medicare Advantage plans. All right, let's move on to number five. Always zero premium. So the big thing that, again, if a budget was not an issue, pretty much everybody would get an F or a G. F, it's more difficult because you have to a certain age, but everybody would probably get a G if it was zero premium, but they're not. That's why a lot of people, their budget just dictates that they can only go to a Medicare Advantage plan. But a lot of those Medicare Advantage plans are zero premium now, but that wasn't the case many years ago. And perhaps that won't be the case in the future. We don't know what's going to happen in the future. But once you're in a Medicare Advantage plan, you're kind of at the mercy of that. How difficult is it to switch from a Medicare Advantage plan to a Medicare Supplement plan, other than obviously, having that letter that you've been canceled?
Sure. So in the event that you're not in a plan that's being canceled this year, unless you have been on Medicare for less than 6 months, you're going to have to go through medical underwriting, which means that they're going to be asking you questions about your mobility, your heart history, your any kind of internal cancers that they've looked at, anything that might be pending from a test result or a diagnostic treatment. They go really deep into your medical history and to see the outlook of how insurable you are for a Medicare supplement plan. Now, that's just a piece of it. If you're somebody that's healthy, great, you should be able to pass underwriting, but there's only certain times a year that you can do it because you have to have an enrollment period to get out of your Medicare Advantage plan. And for the vast majority of Americans, that's going to be during annual enrollment period, which is October 15th through December 7th. Outside of that, you have to kind of wait for that moment to be able to do so.
Yeah, that's what a lot of the enrollment periods. It's kind of a nightmare. So if you have original Medicare and a Medicare supplement plan, and if you want to switch your Medicare supplement plan, you can do that every day of the year, right?
Yeah, you can switch your Medicare supplement plan at any point to another one.
Yeah. So it's basically if you're in a G and want to go to another company and save some money and find a cheaper G, or from a G to an N or N to a G, if you're healthy and or you have some type of special enrollment period, well, you don't have to go through health underwriting. You know, 365 days of the year, it's predominantly health underwriting, except for a few states, right?
That's correct. There's just a handful of states like New York, Connecticut, Massachusetts. Maine has a special one. Washington, California, Missouri are kind of the known ones, if you will. So if you're in one of those 7 states, there's some workarounds that you can kind of get into a supplement plan. But as you can see, the other 43 states are going to leave you having to go through that underwriting process.
Okay, perfect. All right, let's move on to number six. The Part D, the prescription drug part embedded in Medicare Advantage, is not always the best. There's kind of a trade-off, right? So if you have original Medicare supplement, then you can choose from any Part D, standalone Part D plan in your area. But if you choose a Medicare Advantage, the Part D is not always the best in Medicare Advantage, and you're kind of limited because you're like, okay, well, I need this doctor, and there's only 3 or 4 plans that have the doctor I really want. So you're kind of stuck with maybe just 2 or 3, whatever Part D is embedded in that. You cannot get a Medicare Advantage and then get a completely separate Part D plan. Is that correct?
That's correct. It has to be built into the Medicare Advantage plan that you have chosen or narrowed it down to. Of course, you want to make sure you keep your providers in network. And for most people, the Part D plan, as long as they're taking maintenance prescriptions, maybe like a lisinopril, maybe an atorvastatin, they're not gonna notice the trade offs there. It's really when you get into like the insulins or maybe the blood thinners that you may or may not have to take, or maybe it's an inhaler that you have to take. You're going to be much more limited into what you can and can't do depending on the carrier that you end up with. Because one carrier may say, hey, we'll take this one and this one. And then you're like, okay, well, I have to go to this plan now because my doctor takes this one. And you find out what you've been taking on that with them might not work over here. So there's a lot of trade offs that some people have to find out the hard way when they switch their plans.
Yeah, yeah. But luckily, you can switch the plans once a year, and guess what? Now is the time to do it. So if you switch this October 15th to December 7th, the new plan takes effect January 1st. And all you have to do is call that number down there. Thomas and his team will walk you through it. First thing you do is check the doctors. That's the most important thing. Want to make sure they keep their doctors, and then see which plans cover the formularies, save them the most money for their drugs, and then what's the other process y'all do over there?
Yeah, we also going to take a look at your priorities. Like, how do you plan on using the plan? Where do you plan on using the plan? And what have you been used to doing with your health insurance up until this point, and making sure it aligns so that way, because at the end of the day, you only want to have one Medicare conversation a year at most. Otherwise, you want to go back and doing things more fun, like enjoying retirement or spending time with your grandchildren. The more you talk to me, the worse it's probably going to be for you.
Hopefully your wife doesn't say that, right?
Of course, yeah, I hope not.
All right, yeah. What one of the benefits is that chapter I look for. I've interviewed companies throughout the country, seeing which organization is going to help y'all the most, and I narrowed it down the chapter. Thomas and I just did. I kind of interviewed him again about a week or so ago, and I asked him all the questions I asked all the other companies, and chapter was the only one that answered. Let's say that they Freddie Friedman it and they
Oh, well, thank
grand
you.
slam home. You like that? You like how I did
Yeah,
that?
that was
Yeah,
good.
yeah. The grand slam walk off home run. Yeah, they answered every question and above and beyond. So, but even if you only need to talk to Thomas and his team once a year, hopefully, unless you move or something like that. But you also have a team. What do you call it? The member success team. So if there's a problem with you're having a problem with billing or your insurance company or something like that, y'all have a team that helps with that as well, right?
We do. The member success team is really good at handling post-enrollment issues. As you mentioned several times on your show, is insurance companies may not have the smoothest road for you as a client. So you need somebody that's going to stand there at the gate for you to help triage where you need to go and how you need to solve it. The member success team would be your first line of defense to call to solve common issues like billing errors, coding errors, or maybe you just need to help finding a doctor in your area if you're like maybe new to the area or something.
Perfect, perfect. Okay. Hopefully we didn't. And all the Yankees fans that just didn't click off and say, "Forget it, I'm not watching these guys anymore." So anyway, all right. So the final one is avoid Medicare Advantage because people think it's cheaper. Yes, a Medicare supplement is going to cost you a monthly premium, depending on the plan you choose and the part of the country you're in. Medicare Advantage, a lot of them are zero premium. There's some that do have a monthly premium, but most people choose the ones that have a zero premium because it is cheaper. Are is that zero premium plan actually cheaper than a plan that costs $100 a month, Chuck Thomas?
Yeah, in most cases, it's not, Dr. Ed. So usually when you see something that's $0 per month and you have this sinking feeling in the back of your mind that is probably too good to be true, it's a good rule of thumb in this case as well. Because when you start digging into the evidence of coverage, maybe the summary of benefits, you start seeing where those co-insurances could come up and bite you in the event you need it. So a short-term gratification of like, oh, only paid $0 this month for a long-term potential suffering, you just have to be on the lookout for what may or may not come up later through that max out of pocket, those co-insurances, and those diagnostic fees that you'll have to pay.
Yeah, and the fact again is, as I mentioned, it's zero premium now, a lot of these, but that might not necessarily be the fact. Maybe with the entire industry changes. That's why there's so much turmoil in the 2025 plans that's going on right now, is because of all the stuff coming down and the increased prices and the baby boomers and the Inflation Reduction Act and all that stuff. So you get into a plan, oh, it's zero premium, I'm definitely going to do a zero premium. But if you're going to live healthy and you're never going to fall or get injured or scuba diving or whatever, then you're good for the rest of your life at zero premium, if that company, if the industry stays at zero premium. But if something happens sometimes, yeah. So if you have $1 million surgery and you have a plan G, how much do you have to plan? How much of the $1 million do you have to pay with the plan G?
If you haven't touched it at all for the year, just 240 of it. So
Yep.
all you're responsible with on that plan G is the initial Part B deductible, which is $240 this year.
Yep. So if you get a plan F, how much?
Zero. You're 100% covered for any Part A or Part B related expense.
Yep. But with Medicare Advantage, it really depends on the particular area. They've got max out of pockets. I think the lowest I've seen is like in Florida. What's the lowest max out of pocket you've seen in Florida?
I think that would be Broward County, and I've seen some max out of pockets around the $900 range, which is really cool. Orange County in California has those as well. Now, keep in mind that those are usually HMO plans, so
Yes. Yep.
that's the other trade-off as well.
Yeah, but it's out of pocket. Those are very unusual. That's why I kind of point those out in Florida.
Oh yeah,
But just like the hurricane season in there, it's yeah, the insurance rates in Florida are going up. My sister can attest to that. But in the rest of the country, you've got max out of pockets, 2, 3, 4, 5,000, and those reset every single year. So if you go into a doctor at the end of the year, November, December, you have something, and you've got your max out of pocket. You had to pay $5,000, $6,000 out of pocket, and then you're continuing whatever issue you have. In January, you get another bill for $5,000 or $6,000. So, and those max out of pockets go up every single year.
correct.
All right, and the bonus is many plans require referrals. So this is 7+1, and many plans require referrals. Do you have to have a referral with Medicare supplement plans?
You do not. No, as long as they accept Medicare, you can use that particular doctor.
Yep. So anywhere in the country, if you want to go to the big medical facility in Houston or something, jump on a plane and go there. As long as they take original Medicare, they take the Medicare supplement, Medicare Advantage. Not so much, right?
That's correct.
All right. So we went through the 7 and we did that. I knew it was going to take a little bit longer. Usually I like to keep these topics of the day to about 10 or 15 minutes, but these are very important ones that we want to make sure everybody makes the right decision. All right, let's go ahead and jump into some questions here. And this doesn't necessarily only have to be about Medicare. You got any questions on anything, survivor benefits, spouse, retirement, whatever. All right, Tina Girl, we spoke a while back. I collect SSDI, and my husband passed away in June. We spoke a couple of months ago. I applied in July. They sent my file for a full review. It supposedly came back. Oh, and then we got another question to my local office, and I was told that it will take until at least March 2025. Is that correct? If not, who do I contact to rectify? Okay, so you are Tina is receiving Social Security disability insurance, and her husband passed away. So I'm figuring that she is between 50 and 59 years old, and therefore eligible for what's called the disabled widow's benefit. So that's what she filed for. So um, basically, Tina, yes, you have to go through the disability process again. They take the claim, they send it up to the disability decision service in your state. And you're like, wait a second, I'm getting disability. Of course I'm disabled. The issue is there's certain time limitations, so like a 7-year window that you have to apply for disabled widows benefits. You have to be found disabled, and they just have to go through the process. I don't think it should take until March 2025. I think that's the default of what they're telling. In your particular case, it should be a lot quicker. But unfortunately, because of the staffing at Social Security, 50-year low in terms of staffing, it's taking way, way, way too long. When I took the 100,000 disability claims that I took when I was working at Social Security, I used to tell people, and everybody at that time used to tell people 3 to 6 months to get a disability decision. But now with the staffing, 6 to 9 months. So unfortunately, Tina, but if you're disabled, it's just a matter of them determining when you became disabled to see if it was within that time limit. So hopefully it comes back and you'll get 71.5% of your husband's full benefit amount. So good luck to you. Hopefully that works out well for you. Well, I wanted to know if Social Security let someone come in and give them fraud papers and from a notary to get a child's check taken from a parent, and they tell the parent they won't fix. Yeah, I'm not. Yeah, if there's any type of fraud, so yeah, Social Security doesn't usually accept anything from kind of a notary. So I'm not sure what kind of papers. If it's a birth certificate or something like that, it has to be the original birth certificate from the issuing agency. Social Security doesn't really accept notarized copies of anything. Divorce decrees, marriage certificates, birth certificates, they have to be the original. So what are the changes to Part D? It goes away or what? It was mandatory for me in July of 2023. So now what happens in Minneapolis, Minnesota? You want to field that one, the changes to Part D for 2025?
Sure. So there's a lot of moving parts that go along with it, but the main change that you'll notice with your Part D is the coverage gap, also known as the donut hole, is going away. In fact, they're instituting what we would know as a max out of pocket on the drug side at $2,000. So once you have paid $2,000 out of pocket for your prescription drugs, you will pay zero for the remainder of the year for any covered prescription. So covered prescription just has to be on that particular plan's formulary as an aside there. So some other things that we're seeing is we are seeing quite a big increase in premiums to Part D plans for that coverage. And there's also something with CMS Social Security where you can have like a prescription drug payment plan if you take a lot of prescriptions and want to smooth that out throughout the year, might be worth looking into from a cost perspective. So those are the
Yeah.
main changes.
Yeah, that's a great point. The smoothing thing. So if you've, next year's limit is $2,000. This year was like 8,000, but $2,000 a lot more. But if you take a lot of expensive prescriptions, then you meet that 2,000 in January, February. So that means you have to kick out of your pocket $1,000 a month if it's for 2 months, right? So they've got this new smoothing thing. So how do people activate that?
Sure, they'll have to reach out to CMS Social Security to apply for that program or just like elect to take it. They can probably also work with their Part D plan directly as well to do that. So it's just reaching out to those folks and telling them that you would want to do that, and then they can draft that out of. I think they even allow it out of your Social Security check, if I'm not mistaken.
Perfect. Yeah, this is all a brand new thing, came out based on the Inflation Reduction Act. So it's basically, if rather than paying $2,000 for the first month, if that's what immediately hits that limit, then they can say, okay, we'll pay $2,000 over a 12-month period. So that's where the smoothing thing comes in. And let's see here. I think Scott also kind of, I always try to read in between the lines here. There was a big issue up until a few weeks ago that private health insurance, people that are still working, didn't have to sign up for Part B because they have credible coverage. But I guess there was an issue with the Part D that your private coverage is not credible, and therefore you have to go get a Part D plan. But I think they've resolved that temporarily.
Yeah, I believe there was a stay issued on that. So you have in the event that you have private insurance through an employer or just not with Medicare, if it's creditable for Part B, doesn't necessarily mean it's creditable for Part D. In the event that one of the two is not, they're required to send you letters and statements to show you that it's not and encourage you to do that before penalties set in. In that particular case, it was issued a stay at this point, so it's not affecting that particular coverage.
Okay. All right. Until Medicare comes in and tries to figure something out a little bit more. Yeah. So basically, what it is the private insurance companies, if they could charge their people more than $2,000, then it wasn't kind of equivalent to the Medicare Part D, which you can't charge more than 2,000. So I guess there was a little temporary. It's typical government to come up with a regulation and oh, we didn't think about that, and then they have to turn the ship around in the middle. So, yeah, I've had that happen about 1,000 times when I ran my office. I was usually the person that raised my hand and said, "Hey, did y'all think about that?" And they said, "Okay, well, hold off. The whole country, go ahead and hold off, and let's." That annoying Ed, he's always putting. Yeah. Anyway, another question here. My Medicare Advantage plan struck a deal with my medical providers. Okay, so that's probably one of the things you see in the ad all the time, or the news about some hospital system saying, "Hey, we're in negotiations with whatever company, Medicare Advantage," and sometimes they work out, sometimes they don't. But it looks like Sojourners, they came to an agreement, and the Medicare Advantage is going to stay. However, the insurance companies probably kind of gave in a little bit and said, okay, we'll pay your doctors, I guess maybe a living age, or we'll let you a living wage. But we didn't want to pay y'all that much. Your hospital, we didn't want to pay y'all that much, but I guess we'll pay you a little bit extra. So then the insurance companies go back and they look at their plan and they try to make it up by reducing the eye, dental, and over-the-counter credit. You seeing a lot of that happen right about now?
Yeah, absolutely. For the plans that do remain that weren't canceled, they've either been significantly downgraded or the new plans that came out for this year that weren't available last year don't look near as rich as they have in previous years. So that's not surprising at all to see that statement.
Yeah. And I've seen what 70, 60, 70. What percentage of people that have you seen that don't even review their plans? That just stay automatic pilot for years.
Ooh, I don't know if I have a specific percentage on that. It wouldn't surprise me if that 60 to 70% number was accurate. There were so many people that I would talk to when I was an advisor on the phone that would say, "Well, I've had this same plan for 15 years," and you look at it, and you're like, "Wow, you're actually paying a premium for this plan. I can't believe this." So
I've
it
talked
happens.
I've talked to some of these health insurance companies, and they have plans, because again, the same insurance company probably has, 5, 6, 7, 8 different plans in your particular area, but they also have more than that. Some of those that they have a plan, but there might be like 100 people in the entire state that has it, but they don't cancel it. Nobody would ever sign up for that plan if they were given a choice. But the people those 100 people are so stubborn that oh, I like my plan and I don't want to change, and change is scary and all this stuff, but
Mhm.
they're paying the worst, especially if they fall or get sick or something like that. They have a massive exposure, but they're not willing to switch. And the guy pretty much just said, yeah, we're just making, we're going to make tons of money off these 100 people, and but they don't want to switch. They refuse to switch.
Yeah,
So
it's really
15
unfortunate when you see that.
yeah, 15 years on the same plan. Wow. All right, Russ, I have disability and get SSI and SSDI from UHC if I move from Utah to, okay, so all right, yeah. So a lot of people don't recognize that when you're on disability, you can get SSDI and SSI. SSI is SSI is supplemental security income. SSDI is Social Security Disability Insurance. They're both administered from the Social Security Administration, and SSI is a welfare-based program. So if you only get $200, $300, $400 from regular SSDI, if you're low income and resources, they can also add SSI. This year, it goes up to $943. So a lot of people don't recognize that they're getting both. And if you're receiving SSI, you can probably also get Medicaid from the state to pay for your Part B premium. And then if that happens, then you can call Thomas and their team and his team and get set up with a Medicare Advantage dual eligible plan. And those are the ones with the usually have a lot more benefits than regular normal plans, right?
That's right. Correct.
Yep. All right, and so there's something about a move. So if you have a Medicare supplement plan and you move to a new area, a new state, what do you have to do?
You simply just have to update the address with them. Your rate may change depending on the area that you do move to, but there you will not need to change your plan.
Okay, so if you have a G in Utah and you move to Colorado, you just update, and they may charge you a little bit extra for the Medicare supplement based on Colorado rates.
That's correct. Yes, sir.
Okay, and if that happens, do you get a special enrollment period to switch from a G to another G, for instance, maybe a cheaper G?
That's a good question. The answer is no on that one. So, in the event that you move from one state to another and you have a supplement plan, it may be good just to check in with your advisor or the member success team to see what the rate would potentially go to by moving to that area. Because if you go from somewhere like Florida to South Carolina, the rate actually might go down. But like you said, going from Utah to Colorado, maybe the rate goes up a little bit. But there's only a handful of states where it's drastically different than other states.
So, and because if you have a Medicare supplement, you also have a standalone Part D plan, and that's 100% you have to change it, right?
Yeah, you do have to change that one for sure.
Okay, perfect. Okay, now Medicare Advantage. You move from one state to another and one area to another. What do you have to do with your Medicare Advantage?
Same thing as that Part D. You'll have to change your plan if you move out of the service area. So If you go from somewhere like Florida to another state, you're probably not going to see what you saw there, and it could be a little bit of a shell shock. But keep in mind when you do move from one state to another, if you've been in a Medicare Advantage plan, this could be or this is your opportunity rather to have a guaranteed issue window to look at a supplement plan if you want to change up how you're doing it.
Okay, perfect. All right. Hilo girl. Hey, Hilo, Hawaii. All right. We'll give you a Kamaina discount here and give you a free answer to your question. I went to the University of Hawaii there when I was stationed at Camp Smith in Kaneohe Bay, Hawaii. So, all right, let's see. Full retirement age is December 2024. Plan to retire effective February 2025. Will receive last check in February. Will it affect my Social Security in any way? As in SSA amount, data I received first. No, your full retirement age is December 2024. So starting December 2024, you can make $1 billion a month and it doesn't affect your Social Security benefit negatively at all. The only thing it can do is increase your benefits, because Social Security is how they determine your benefit amount is your high 35 years of earnings. So if 2024 was one of your high years, once you do your taxes, you talk to your friends at the IRS there, and then the IRS notifies Social Security how much you made for 2024. And if it's one of your high 35 years, your benefit is automatically recalculated and you get more money. But in terms of a negative effect, nope, no negative effect whatsoever. All right, let's see here. Lori, can I change brokers? I only signed up October 1, special enrollment period. I want to see if I can find a cheaper Plan G and review Part D. I want to call Chapter. Also, does Chapter service the plans afterwards? Go for
Yeah,
it, Thomas. It's all you.
yeah, that's an easy one. Absolutely. So, if you want to review the plans that you currently have to ensure you're on the most comprehensive one, at any point in time, you can reach out to us. There's no fee for us to do that.
Okay. Yeah, that's and this is important. Yes, you can change brokers anytime you want. That's not an issue. You can change plans. If you've already signed up for a plan, this is your special enrollment period, October 15th to December 7th. You can, if you already signed up and enrolled in another plan and you're just not feeling it, and so you can reach out to Chapter, and if they can kind of give you a second opinion, and whether that was the best plan for you, or maybe there's another plan out there. Because what the issue is, and the reason I chose Chapter, is that if you talk to an agent, a traditional captive agent, they work for one company. So it's kind of like the old Henry Ford thing. You can have any color of car you want as long as it's black. So if you talk to an agent that only sells one company, then that's the one you're going to get referred to. There are brokers out there that work for many companies, or contracted with many companies, and they'll give you which kind of companies. They'll give you the plans for those particular companies. The great thing about Chapter is they are contracted with most companies throughout the country, and even if there's one regional, very limited regional one that they're not, if that happens to be the best plan, what do y'all do?
Yeah, we simply tell them that they're on the best plan, and we wouldn't make any kind of changes. Our advisors are as agnostic as we could possibly make them when it comes to what plans they recommend. And if you're on the correct one for the area, we're more than happy to tell you that.
Or if you find another one that Chapter is not necessarily contracted with, one of these very, very small regional, doctor Medicare Advantage, what do y'all do if y'all are just not licensed or contracted to sell that one? What do y'all do?
Sure. Our system can see every single plan in the United States that is available to those through Medicare, as well as supplements, prescription drug plans, and Medicare Advantage plans. If we land on a situation where the plan that is the right one for you is not one that we personally can write, we can refer you to that carrier directly and say, "Hey, work with them. We can't beat this one." The advisor that makes that recommendation is going to get paid the same as if they wrote that plan for you. Chapter won't make anything, but the advisor is compensated to do the right thing by you. So that's really the core of the mission of what we have.
Yep. That was the Freddie Friedman response that decided me on choosing Chapter. That exactly right there. It's because again, I'm kind of cynical. old Marine Corps sergeant, a little bit cynical. You got to follow the money, and these brokers like, oh, okay, are you making money on this? And Chapter doesn't care. And at least the advisors, I'm sure the company, likes to, to pay their bills and stuff like that. But in terms of the advisor talking to people, if it's the right plan for you, it's the right plan for you. No ifs, ands, or buts. So that's pretty awesome. DeSquirrel, I'm on SSDI, so disability, and I try to avoid company names on a particular plan. Any changes of my plan? Yeah, that company has hundreds of plans throughout the country. So the best thing for DeSquirrel to do is give Thomas a call. Call that number down there, and one of his advisors will walk you through it. Let's see. My PCP cost me $40 without insurance. So why should I pay an incredible price for a supplement plan? I can get my meds from Canada cheap. What do you say to that, Thomas?
So that's a fun conversation that we hear from time to time. And what I would say in response to that is you typically don't get a supplement coverage for your primary care doctor. Yes, they're going to be covered underneath that, but like you put there, it's not very costly to have to go to your primary care. What is costly is if your primary care tells you need to get X, Y, and Z done for diagnostic testing, or it comes into you need to go see a specialist, you need to get surgeries done. It's just like having homeowners insurance or car insurance. None of us really want to have it, but you sure do want it in the event you have a claim or an issue that you really don't want to pay out of pocket for. So self-insurance at the end of the day is your own personal risk tolerance. Is what are you comfortable handling? And for the vast majority of individuals we talk to, they'd rather not come out of pocket for most of the health expenses that are going to happen as they get older.
Yep. Yeah. Everybody hates lawyers until they need one.
Of course.
Yeah. Yeah. Sorry, lawyers. But yeah. Anyway, Frank, losing my plan, it's no longer offered. When looking for a supplement in New York State, am I subject to medical underwriting?
New York is one of those states that is open enrollment year round. So the answer to that question is no, you would not be subject to any medical underwriting in the state of New York.
And because of that, I think New York kind of does it right. Expensive is people that get sick other part of the country, they they're having a nightmare with their Medicare Advantage. They say, I really need a Medicare supplement, but I can't get one. So you see people moving to New York to get the Medicare supplement, but because of that, it's very expensive in New York, right?
It is, and unfortunately, most supplement carriers have left the state of New York because of the actuarial stats. As I try to not trip over my words, there is showing that they're not able to keep up with the claims without having to drastically raise premiums. So, New York State, while it is open enrollment year round, which is great for those that live there, there is a significant premium cost to be able to have that. So, it's kind of a balancing act, if you will.
Yeah, yeah. If every state in the country did it like that, then that wouldn't be an issue. So, yeah. Anyway, there's my soapbox. Should I move to California from Utah, or will I have a problem? PPO.
I mean, I can take a little bit of a stab at this one. I'm not going to name any carrier specifically in this case, but when you do go to the state of California, one thing that I think you will discover, and you can look at this on Medicare.gov if you want to just kind of do some light research, or of course reach out to us, we can tell you. But California is mostly HMO plans. Rarely do we see a good PPO offering.
uh, Imagine this is also confusing. Yes, 100%. That's kind of why I came out of retirement and Social Security and disability and retirement, survivor benefits and Medicare plans. Yeah, it's all too confusing. And I just saw too much of incorrect, incomplete clickbait stuff on the internet out there. So at the prodding of my son says, Dad, you got to get into YouTube. And here we are. Go figure. All right, I just got here. I just got here. My best friend is on Medicare Advantage and Part D prescriptions. It's been working fine for his needs. Perfect. We like to hear that. But I hear that a lot. I've had the same plan for years and I like it, and I haven't had any issues. So I hate to throw a little fly in the honey, but how would you respond to something like that, Thomas?
It's just a matter of what do you feel most comfortable with. If having a little bit more control or freedom to kind of choose in the event you do need medical coverage, you may want to consider going elsewhere. If it's fine for your needs, that's great. But as time goes on, as you need more needs, is it still fitting that bill for you?
Right. And the plan is perfect this year. You love it. It's awesome. That doesn't necessarily mean the plan is going to be the same next year, right? Although that Medicare Advantage, you love it this year. It's like kids, oh, I love my, I love my new Corvette this year, but December 31st, they turned it into a 1972 Pinto. And do you really love 1970? I'm sorry, 1972 Pintos out there, lovers. But all right, let me go for it in the old Corvair, the old Ralph Nader, unsafe at any speeds. I don't know if any Corvair lovers out there, but yeah, is your Corvette turning to a Corvair January 1st? That's the issue right there. So I want to plan, but I do not want to be locked into one that will milk me dry. Yeah, we can all agree with that. It depends on your meds. Part D pats 200% on mostly on generics or low cost on brand names. Do we see a lot of changes for 2025 for different? They're moving tiering and covered generics, and because as a lot of people say, they look at the Part D, the prescription drugs, and they look at their particular prescription drugs, and it's so confusing. Number one, if you look on the plan's website, you see one price. If you look on Medicare.gov, you see a different price for the same medication. Are you seeing that sometimes?
That's usually more of like what inputs did you put in? Levothyroxine is always my favorite example to use because the moment you select capsule instead of tablet, you're going to see like hundreds of dollars more per month for that levothyroxine, and it scares you out of the room. You close the computer and run away. So it really depends on the inputs that you're putting in, all the way down to the pharmacy that you choose. So what I would tell you is go with what the Medicare.gov is showing you on the pricing first and foremost, and make sure that you're inputting that in correctly. That's the source of truth, if you will, if you're doing this on your own.
Okay. Yeah, because it's a difference based on the pharmacy, extended release,
Oh yeah.
capsules, tablets, the quantity,
So
the 30
and there
versus.
Yeah, the 30 versus 60. Are you getting 90-day supply or 30-day supply? Are you doing it mail order? Are you doing 90-day supplies in the pharmacy? There's so many things that could throw those numbers off based on how you're inputting that. So while I would certainly encourage y'all to reach out to our prescription drug plan specialist team, if you're somebody that likes to kind of do it on your own, I usually treat Medicare.gov as the source of truth for those that like to shop on their own.
Perfect, perfect. And since you said that, it's another reason I chose Chapter is because everybody in the industry out there is just saying, "Hey, if you got Part D, you're on your own. Go jump in the deep end. Go to Medicare.gov and do it yourself." Because of all the turmoil in kind of the industry, the insurance companies are now no longer paying insurance and advisors. Most of them, a lot of them, they're not paying commissions to help people sign up for Part D. And so, because these people out there that help you sign up, it's just like, well, I spend 30 minutes, going through this person prescriptions, but I'm not making any money to support my family and pay my rent, which is understandable. Insurance companies are making tons of money, obviously,
Of
but they're
course.
not paying us any. But Chapter has kind of bucked the trend, and y'all have gone the completely opposite way, where you're actually putting together a team that specifically helps with Part D, right?
Correct. We're going against the grain for the industry by doing this. We specialize in an entire group of individuals that really got to know the changes of the Part D plans as well as the different options that are available to each individual person. So while we don't think this is a long-term effect of the industry of the whole non-commissionable route and things like that, we think long term that'll be remedied down the road because you need advisors to kind of help you through the confusion of Medicare. Because as somebody mentioned earlier, it is all confusing and it's not being simplified. We try to make it as simplified as possible, and we believe long term that having a specialized Part D plan will be on the forefront for this industry.
Okay. Yeah, and that's again the cynical part of me. It's like, follow the money. Okay, so how does insurance agents, and brokers, and Chapter and everybody gets paid? Again, the advisors of Chapter are completely neutral. It doesn't matter which plan you choose. The particular advisor, still able to feed their family and everything. But But all of this, people don't understand that y'all already paid for all of this. All those decades you paid FICA. So FICA includes Social Security tax and a Medicare tax. You pay part of it and your employer pays the other part of it, unless you're self-employed where you have to pay both of it. But you pay that for decades. So all of those decades of Medicare tax you paid is sitting somewhere in Washington in a bank or trust fund, and then when you sign up for Medicare Advantage, yada yada yada, or Part D, yada yada yada, then that particular company goes to Washington and says, "Hey, Christina, Christina paid into Medicare for all these decades. Give us that money." And that's the money, Christina, you already paid for Thomas and his team to help you out. So you sign up for a particular company, and that particular company compensates Thomas and his team and every other insurance agent and broker through the country. And that's how all of that is funded. So you already paid for it. So it's incumbent upon you to get the best service that you've already paid for. You've paid it forward. You paid for Thomas and his team and every insurance agent in the country for decades, and now go get your help. And now it's 100% free. You don't have to pay because you've already paid for it. Is that a probably pretty good characterization of it?
Yeah, I think that's pretty fair.
Yeah. All right. Charlotte, I apologize. No, don't apologize. Any questions are open. This is a divorced spouse question. One of my previous husbands, who I had been married to over 10 years and I couldn't draw from because I made more than him, died. Can I now? That is a good question. And a lot of people I know out there are losing money because even though you made more perhaps than him, because again, you have to look at the entire 35 years of earnings. So you might have made more than him for the last 5 years or 10 years, or perhaps the entire time. But what I see out there is people call and see if they're entitled to any spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits, whatever the case may be. And Social Security looks at their record, their PIA, their primary insurance amount, and they look at your benefit amount, your primary insurance amount. And if yours is less than half of that person's, then you can get more money. Okay. So make sure everybody does that out there. But what I see is Social Security, if it's not twice the amount, then you're not going to get any money. So what the Social Security employees are saying is that you're not entitled to any benefits. But they don't fit, they should really continue and say, okay, you're eligible for benefits. You were married 10 years and you're currently not married and everything. You're good there, but there's just no more money right now. If anything should happen to that person, if they shuffle off their mortal coil, then those numbers change. So it doesn't have to be twice your benefit amount. It has to be any amount more than yours. So in your particular case, Charlotte, you might not have been eligible for benefits while he was out there alive and kicking, but that might be different now. So I would call Social Security and say, hey, I want to file for surviving spouse benefits. And then you give them the Social Security number. If you don't know the Social Security number, no big deal. Just tell them the person's name, the date of birth, where they were born, as much as you know that information, and they'll be able to find the social, and they'll tell you whether there's any more money on that record. If there is, then they'll and go get your money. And the most important thing on this channel is please don't do this just for you. If you have friends, families, neighbors, a little old lady down the street that needs help with Social Security, survivor benefits, disability, retirement benefits, Medicare, Medicaid, Medicare plans, Medicare supplements, make sure you reach out to them, bring them to this channel, jump into live Q&A, ask questions for them, call Thomas and his team. They'll help you out with Medicare plans, Medicare Advantage, Medicare supplements, Part D, and all the rest of it. So yeah, let's look out for our community out there. Please, please, please. All right, let's see. Get some other questions. We're coming down to the end. Let me grab some people I haven't seen here before. Let's see. My Medicare Advantage was really fantastic this year, even though I couldn't use the $7,000 dental free because I had maxilla and bone infection. I did use the $1,500 2025 no plan. Wow, that Somebody complained on one of my YouTube comments, I think yesterday. There's nobody in the country that has $4,000 dental, and well, this person had $7,000 dental. Wow, that I think that's the max I've seen is $7,000 dental. Have you seen one like that?
I've seen larger. I've seen it
Really?
as high as 20,000. So
Wow. Oh, that's right. Yeah, there's some that do the are doing what are the new dental, the not the caps, what
uh, the implants.
the implants. Yes, yes. But those are crazy expensive. I think 20,000 to get you what, two or three teeth or something?
Yeah, it's like it gets you 2 tires instead of 4 tires. So
Right. Exactly. But yeah, but as I always say on these, get your Medicare Advantage. So if you choose a Medicare Advantage, which again, we're not talking bad about Medicare Advantage or Medicare Supplement. It's 100% your particular case. So don't let anybody kind of. I see a lot of people, talking bad about, oh, the people that get Medicare Advantage or da da da. No, if you want to pay that person's, Medicare supplement $120 a month, then you can go ahead and pay that person's $120 a month. That person just doesn't have the money to pay for it. So it's not in their budget. So stop harassing other people about stuff like that. But in terms of Medicare Advantage, if that's what you got, it's it just takes a little bit more effort. An hour a year on the phone with Thomas and his team there. And if you have and you can, again, you really need to be strategic on this because the insurance companies are definitely strategic. If coming in 2025 you're going to have a lot of dental, find a plan that has a lot of dental, and you're like, well, it doesn't really have the specialist I like. Are you going to see the specialist well, I'm not going to see the specialist next year, but it's a little bit more for a hospital, it's a little bit more for MRI. But your year for next year is really focused on the dental, so get a plan with the most dental, and then next year go back to your specialist or whatever the case may be, so you can design your plan every year to get what you need. Is that a pretty good strategy there, Thomas?
yeah, just very much just got to be really thick in the planning on what your priorities are going into that following year.
Exactly. And that's the first question y'all ask, right?
Yes, sir. Absolutely.
All right. Wow, we have got way too many questions we weren't able to get through, but luckily I'm going to be doing this live in Q&A every single day, and probably till the end of the year here. I might take off on Thanksgiving though, but we shall see. Or if there's another blowout in baseball coming here, we'll see what's going on. So please, if I didn't get your question, if we didn't get your question today, go ahead and cut and paste it, and then join me in my next Q&A, and I definitely will get to it if you pop it up first thing. All right, Thomas, I sure do appreciate it. Again, hopefully we'll see you soon, and you
Sounds
take care
good,
of
Dr.
yourself.
Ed. I
All right.